Hello, Bio 130 students, and welcome to our second part into the urinary system. For this lesson, we're going to get into a brief list of urological diseases. One of the most common affecting the urinary system is actually kidney stones. I personally have many coworkers and family members who have been afflicted with kidney stones, and I would not be surprised if all of you know at least one person. For kidney stones, there are two very common types. There are calcium oxalate kidney stones and uric acid kidney stones. Calcium oxalate kidney stones are formed when calcium and oxalate combine, forming solid calcium oxalate stones. And uric acid stones can form when there's not enough water diluting waste components in the kidneys. Both are very insoluble in water, which is why they will tend to stay as rough, solid material in the kidneys as they are being passed. These kidney stones can often have very sharp edges and barbs around the surface, which can cut into the inner lining of the urinary tract, which can result in bleeding as well as potential infection from the waste products in urine or bacteria in urine, causing inflammation and other issues. Now, if those kidney stones are too large, however, they might actually block the flow of urine through the ureters, and that would be quite a terrible issue. With small stones, most often what happens is that pain medication is given to help relieve the issues as those kidney stones are traveling out the body. In the case of large kidney stones, surgery will be needed to go in there and help break apart those kidney stones, thus once again allowing them to travel and allowing, proper flow of urine again. And there are cases where kidney stones can form actually inside the kidneys before you get to the ureters, and in those cases, someone will need to go in there and extract those stones. And unlike other issues, which can be inherited issues or issues that develop over time, kidney stones are actually the result of your diet. Oddly enough, there's sort of a double-edged sword between whether you eat meat or whether you eat anything else. If you eat too much meat, you run the risk of having high cholesterol. But if you eat too much, say, grains, too much dark vegetables, too much dairy, you run the risk of having high oxalate, which can then combine with calcium to form kidney stones. So whether you eat too much, if you eat too much meat or you eat too much of anything else, you run the risk of either having high cholesterol in the case of meat or high oxalate in the case of everything else. Oddly enough, calcium supplements and also calcium in milk can actually help prevent kidney stones by the calcium binding with oxalate before either are absorbed into the bloodstream and filtered in the kidneys. Now, the condition of urinary incontinence affects the two sphincter muscles that are present in the urethra. These two muscles essentially help the body store urine so that it's not constantly releasing urine out, because there could be conditions where it's not advantageous for you to release your urine, and then there are moments where your body would be ready to release the urine you have stored. So basically, these muscles help you store your urine until you are ready to release them. One version of urinary incontinence is where the sphincter muscles are actually too weak. And when they are too weak, essentially they're not strong enough to hold back urine being stored in your bladder. And they could be so weak that a simple sneeze or cough could actually result in unwanted or unprepared urination. But there is also a situation where the muscles are too active. And essentially what happens is that the muscles will signal that it's time to urinate, even if there's not much urine present in your bladder. So under that scenario, it can actually prevent you from properly storing urine to the point when you are ready to release it. And this is a condition that becomes more common in people as they age. So in many cases, it's a natural occurrence in the people that it affects. There is also another situation which involves cysts, and we'll cover two different types of cyst kidney diseases. Now, cysts, when it comes to the kidneys, these are pouches that can form in the kidney tissue, and they usually fill up with fluids. They could actually fill up with blood or other liquids as well. One condition is called polycystic kidney disease, and this is an inherited disease that you get from your parents. And under this condition, the cysts form outside the kidneys, and this results in the enlargement and eventually the failure of the kidneys. Management of polycystic kidney disease is difficult as it is an inherited disease, but management can involve dialysis or, if the kidneys should fail, transplantation. There is another situation called acquired cystic kidney disease, and generally this is found in patients who are already on dialysis for a different chronic kidney disease. And while the kidneys do not enlarge under this situation, cysts, unlike in polycystic disease, under acquired cystic kidney disease, the kidneys will not enlarge and the cysts will only form inside the kidneys, and many times no other symptoms will occur, thus allowing the kidneys to function properly regardless of the presence of those cysts. Now those are just three types of possible issues, diseases, disorders that can happen with the urinary system. For your discussion activity, you are welcome to discuss the information that was presented in this lesson, as well as your particular insights. Those insights can be information or experiences you are aware of personally or from family or friends, coworkers, etc. Essentially anything that you can think of that stood out to you in this lesson on disorders of the urinary system, or that you can think of to add from your personal experience. Furthermore, you'll be responsible for responding to one of your classmates' threads on the insights that they discussed. And well, for getting close to the 10-minute mark, it has been a pleasure to present this basic urinary system lesson this week for all of you. catch you guys next week for what I believe will be your first exam week. If that's the case, we will cover. There will be a review video for basically what you can expect on the test. Well, that's all, guys.